What is a kidney?
It's like a red bean. You put it in chili and stuff.
That's not even close. What is a kidney?
It is a body part.
What is nephrology?
I think I know this one. It is the study of Nerf weapons.
No, it's the study of kidneys.
So I wasn't even close.
You were kind of close.
Okay, good.
Can you tell me where your kidneys are?
All right, I think is it back here?
That's absolutely correct.
Yes, awesome.
What is atypical HUS?
It sounds like a type of car.
I don't even know what it is.
Atypical HUS, which is what I have, is it stands for hemolytic uremic syndrome. It's caused by the complement system and when it gets out of control. And the complement system is a part of your immune system. And when this happens, blood clots start forming in your small blood vessels, which can eventually lead or can lead to kidney or heart failure. So before, when I was really sick, I couldn't eat. I didn't have a good appetite. I couldn't go to school and see my friends and learn like all the other kids. And I couldn't even play my favorite sport, which is soccer. And now, you know, although I have to go to Levine every other week, it doesn't interfere with my education, with my friends, me hanging out with my friends, or interfere with my soccer, which I play competitively.
What do you think of when you hear the word transplant?
Something's getting replaced.
Kind of. What do you think of?
Well, I think of a lot. I think Carrie's right, but I think a lot of people are on a list. They're waiting for a healthy organ to come their way, like a kidney, like I gave to my dad.
Wow, that's really nice. I got a kidney transplant too, but I didn't give one.
Who gave you your kidney?
My dad and my uncle both gave me a kidney. My dad gave me the first one, and then after that, like 5 years later, I needed another one, and my uncle gave me one.
So the happiest moment for me during Theo's hospital stay was the day that he got a kidney transplant, and his aunt, my wife's older sister, was the donor. We chose Levine Children's Hospital because it's a place where we could get really world-class care 5 minutes from our house. Had it not been for Levine Children's Hospital and the staff here and this place existing, we probably would have had to move someplace else where we could be closer to world-class care, but we found it right here.
What is a nephrologist?
Someone who makes Nerf weapons.
No, it's a kind of doctor who works with kidneys.
I see a kidney doctor because I had a kidney transplant when I was 11 years old, and I need to follow up to just see how my kidney's doing.
What is a FSGS?
I have no idea.
It's a type of nephronic syndrome.
FSGS is focal segmental glomerulus scissurus, which is scarring on my kidneys. I have to have lots of fluids, and I normally have to actually eat sometimes, like on a certain basis, because like the prednisone will after when I wake up in the morning, if I don't eat within a couple hours, it kind of feels weird and empty.
Elena Palmer has nephrotic syndrome. She has not had a relapse in about 2 years, so we haven't had to come to the hospital. But we just have stopped her medications, so we're hopeful that she'll keep doing well and not have a relapse. Levine is definitely a wonderful place for the children. Everybody always takes care of us, and we really hope we don't have to come back anytime soon, but if we do, we know we'll be in really good hands here at Levine.
How about you, Doc? Do you know what a kidney is?
Well, Mikey, I happen to know a whole lot about kidneys. Well, one of the things that I'm very proud of is over the last 7 years, we've been named in the U.S. News and World Report for Pediatric Nephrology. It's a start. With that, the more we're able to do collaborative studies, the more we're able to bring in prominence with respect to this community. It helps the kids in this region. Certainly the passion is here, the interest is here. We've got great families, we've got a great community, and it's just time to take advantage of that. I think one of the most difficult things with kidney disease is that it's so silent. These kids can look spectacularly well, and they're close to being on dialysis, or they've undergone a transplant, or they're heading toward that, or they're in and out of the hospital. And so there's very few tangible things sometimes that people see. This analogy that I've come up with is it's like a stealth thief. It comes in the night, it steals things away from these families and from these patients. It steals away that childhood time that we want to be so innocent and full of fun. That's the impact of kidney disease on these kids.
Why am I supporting the Nephrology Center of Excellence? It affects our family personally, but more importantly than that, I'm honored to be a part of the host committee to help launch this center. It will be a three-pronged center that will help families that are diagnosed with kidney illnesses to become educated on what their new life will become and how to navigate that pathway. It will also help start research and do clinical studies on why these kids have this disease and how do you find a cure. And also, most importantly, the quality of care that patients receive and the excellent service that this hospital provides. To me, it's a no-brainer.
Help kids like me.
Help kids like me.
We want you on our team.